Hello, this is Dr. Nathan Way again, and today I'm going to be talking about arthritis treatment, how stem cells are administered. And this is tip number 4 in our series. The first thing is processing the stem cells. The source that we get stem cells from are generally both bone marrow and fat. Those are two areas that are rich in what are called mesenchymal stem cells. Really important to avoid clots forming because clotting will really mess up the processing procedure. It's very important to avoid platelet activation because platelets are the cells that have growth factors that stimulate stem cell multiplication. So if you activate the platelets too early, you're not going to get the best outcome. And finally, you have to maximize the yield on your stem cells. Administration, everybody's joint is different. Everybody's knee is different. Everybody's arthritis is different. So you have to determine where the disease is most severe, and that's usually where the patient hurts the most. So determining the sites of disease, the extent of involvement, which compartments are involved, whether it's a knee or an elbow or shoulder. Again, very important to examine the patient, do a diagnostic ultrasound examination. If you have an MRI or x-rays, all those are helpful. It's controversial yet whether it's important to administer an acute injury. I personally feel that it is important because that's what sets the stem cell cascade into action. So where and how to administer acute injury is also an important factor. And finally, I've already talked about the use of ultrasound guidance. Other considerations, whether you should use a matrix, some kind of materials to hold everything together is still under consideration. Again, I think it makes sense to use some kind of matrix to keep the stem cells in one place, to keep them from migrating. And finally, really, again, it's critical that the administration of growth factors along with your stem cell graft is done properly and done at the same time. That's it for now. The resources I'd like to point you towards are two websites, www.arthritistreatmentcenter.com and www.arthritistreatmentandrelief.com. Thanks for watching. This is Dr. Nathan Way.